Hi, I am Windsor Sherrill, and I'm faculty in public health sciences. I'm a provost distinguished professor, and I also serve as Clemson's associate vice president for health research. I've been on faculty at Clemson since 2000. My doctoral degree is in health policy from the Heller School at Brandeis University. Prior to coming on faculty and beginning my career in the academy, I received graduate degrees in business administration and health administration and worked in healthcare as a manager and administrator in academic health centers. So what I do as a faculty member is really informed by my experiences working in healthcare administration. I love to work with students and help them prepare for health-related careers or either health research. And I like to design research projects that have an impact on the healthcare system. And typically my research is finds a foundation in my experience in healthcare. In general, if I think about the purpose of my research, I see healthcare as a very complicated, complex, and problematic system. It's a very challenging industry. What I see in this industry is a set of challenges that are very unique. We have cost challenges, we have access challenges, we have quality problems. And I think to solve some of these problems, we need to leverage the best of our health research and the best of our research methodology to analyze, assess, and think about how we can deliver healthcare differently, both in the micro and the macro approach. We spend more on healthcare than any other country, and we don't get very much better outcomes. In fact, we get worse outcomes in many countries. And it just seems that we have many opportunities to improve this system. And I've seen throughout my career that it's very challenging sometimes. People who are working within the healthcare system maybe cannot see they're working so hard every day within the constraints of the policy systems, financial systems. They really don't have a chance to step back and see how do we reorganize, re-engineer, and restructure the system for better outcomes, lower cost, and better access. So what researchers want, particularly healthcare researchers, and I'm no exception, is for their research to make a difference. And I think that that has been hopefully an underlying mission in all of my research thus far, since I've been a faculty member. Obviously, healthcare research has significant opportunity to have impact in the larger society and community. It's a huge proportion of our gross national product, and it's a huge impact to all of us every day. So that's what generally motivates me as far as in my area of research, thinking about where I just got my passion for research and the fact that I really feel very fortunate to get to do both administrative activities and to continue my own research. I really feel like healthcare challenges are so complicated and so intractable that they cannot be solved by traditional approaches of the healthcare system. And I think about how research and some of our programmatic initiatives are thinking about total redesign, looking at things in a different way. The project I'm going to talk to you guys about today, Health Extension for Diabetes, really is thinking about using a system where we don't try to depend on our providers, clinicians, and nurses to solve all of our challenges, but use some paraprofessional folks to really help us do better health education and better chronic disease management. So a few examples of areas of research that I've found to be very impactful and very rewarding in my own career and things I've been involved with recently. I serve on Clemson's COBRE grant called SE-TRIM, and that stands for Translational Research in Musculoskeletal Health. I've had a chance to be a part of the administrative investigative team for that project. A COBRE is a Center of Excellence and Center of Biomedical Research Excellence. This is an NIH-funded initiative, very, very large program to try to develop junior faculty into being R01 funded investigators and building a theme of research for the institution. So for SE-TRIM, our theme is around orthopedics research, and it's been amazing to see some of the growth in that area, both for Clemson and our research partners. Another very rewarding area of research I've been involved with, and I think has significant societal impact, is the Managing Abstinence in Newborns Initiative. We call it the MAIN Initiative. About a decade ago, one of our partners at Prisma Health, a pediatrician, realized there had to be a better way to manage care for infants born with abstinence syndrome, how to better support those infants, their care, and their care of the mother-baby dyad. So she had done a very innovative care protocol, but she had not had any evaluation research connected to that protocol. So the Clemson team came along beside her. I've got a long background in financial impact research, evaluation research, and we looked at that program and found that it had extremely good results as far as quality, and perhaps equally important as far as ROI, return on financial investment. The state of South Carolina asked us to work with other hospitals across the state to replicate the program, and we've seen it go across several other hospitals in South Carolina. Great thing about that, huge problem in our state, in our country, the opioid crisis and abstinence syndrome for our mothers and babies. And we saw a great care protocol, very innovative, but then we leveraged research and evaluation research and financial impact research to prove the program was very worthwhile, and that gave us evidence to spread it to other locations. So again, I see that as significant impact societally. We have a huge challenge that we're trying to address as far as healthcare, health outcomes. We use our research expertise to try to look at that and support those goals. And then finally, the project I want to tell you about primarily today is a program we have called Health Extension for Diabetes. And it has been one of the most rewarding projects of my career academically, because I feel like it's innovative. We're using our great research, we're using our great health system partnerships to really have an impact on a very significant healthcare challenge, diabetes. So the Health Extension for Diabetes programs takes advantage of some very unique opportunities we have at the land-grant university. I'm in public health sciences, and our faculty are engaged in looking at challenges like diabetes incidence, like diabetes outcome, and think about how we can leverage research to improve some of those challenges. We were very committed from the very beginning to say, we're going to have significant pre-post behavioral, knowledge, health outcomes, data measured, collected from individuals that go through the program. We have pre-test, post-test. We actually, in our first iteration of the program, followed participants for 3 years. We were looking at, could a program like this make a difference as far as someone staying out of the hospital, saving healthcare dollars, and really addressing some of those true challenges of a person living with diabetes long term. I'm pleased to report that we have had great results. Our participants have lost weight, they've improved nutrition skills, we've lowered healthcare costs, and payers always want to know, have you lowered A1Cs? And we've seen great results. So some of our best wins there, some of our recognition of how we know the program is doing a good job as far as milestones. We've had healthcare payers like Blue Cross Blue Shield look at this program positively. We've received statewide awards. We received the Health Impact Statewide Award from the state of South Carolina. We also received ADA recognition of the program. And ADA, as you know, the American Diabetes Association, recognized Health Extension for Diabetes as a practice-tested educational intervention program that was effective for our clients. So with that ADA recognition, we received in 2019, the CDC, Center for Disease Control, noticed our program and most recently listed the Health Extension for Diabetes program in their call for funding proposals. That resulted in us having a CDC $5 million funding award to expand the program to 4 other states working with land-grant universities, Tennessee, Alabama, North Carolina, and Georgia. So I say that story to share. It's been a very long process, but it's been a process of building relationships, working with stakeholders. It's been a process of slow growth, not always steady growth, fits and starts as most programs would be, but just continued effort to think about, okay, how can we do what we do best as a land-grant university, as a public health science researchers, partnering with healthcare systems, but also using very rigorous evaluation research tools and methods to make sure what we're doing is truly making a difference. Are we having that ROI? And as far as because we know if we don't, these programs will never become part of the healthcare system long term. So it has been wonderful to see those milestones as they've gone through the program. We've had lots of opportunities for change and improvement of the program and lots of barriers and facilitators to the program. But thinking about that question of approaching difficult decisions during the research process, thinking about the question of how we deal with challenges. Again, just like any programmatic research, implementation is always a challenge. What you think might be easy may be more difficult. Some of the things that you think might be difficult end up being smoother. We've tried to, through the process, always look for win-win solutions. Another thing to think about as far as difficult decisions during the research projects or thinking about some of the challenges here. If you think about the fact that in many cases as researchers, as health researchers, the first thing we have to think about pragmatically is who will fund our research, and that can be a challenge. It may be in some cases that NIH or NSF, our traditional funders, will have very different measures and parameters for determining if research is worth their funding. But my message to you is that is a challenge. We faced that challenge. We ended up getting more funding initially from more untraditional funders. Actually, the first iteration of Health Extension for Diabetes was funded by a county-wide foundation that was focused on healthcare and healthcare challenges and outcomes. But over time, we've seen our more traditional funders like CDC begin to value the work. So that is going to always, I think, be a challenge for university-based healthcare researchers. Pragmatically, we have to focus on funding and research funding to get our work off the ground. But if we're thinking about that focus on larger impact, societal focus, community focus, you have to kind of think about that mission and keep that kind of out in front of you to make sure, again, what we want to see as researchers, especially health researchers, is that our work makes a difference. And how do you balance that? Wanting to have research and pure, if you will, research questions and research methodology, and also pragmatic application of that work. I think a lot of funders like NIH are calling that research translation. I know that STRIDE is focused on enhancing research translation capacity at Clemson. And I just think that's one of the most important things we can do as far as, again, making sure our research does have practical application. So that brings us to that question of the many challenges we face in translating our research into real-world societal and community applications. We've talked a lot about that. The Health Extension for Diabetes program, I think, is a great example. Again, because it took so long to develop the program. We plateaued at different times. There were times we thought we might just give up because the program didn't quite fit into traditional healthcare system delivery. Third-party funders were interested, but not quite willing to fund initially. And then at times it felt like it didn't quite fit into the traditional extension model. And also, did it have the research validity and strength they wanted it to have? So looking at all those challenges, we just try to kind of think about the purpose of what we were trying to do with the program. So I would just say that if you're looking for encouragement, please be encouraged that the research process is long and arduous and challenging and frustrating at times, but keeping those goals of potential impact and making a difference. And I think as health researchers, we are particularly in a great spot to make a difference and have some societal impact. So I think STRIDE as a program that's really looking how to enhance all of Clemson's ability to do better research translation is doing important work. Advice I would give other researchers looking to translate their research into practical application. That is a great question. I guess the first advice I would offer is to stick with it. If you have a good research idea that you think does have impact and application and is translatable to results in improving something societally, it's worth sticking with it. Don't be completely discouraged by funders. Indeed, our funders have to look at things in very narrow research questions. So sometimes it feels like they don't appreciate the entire scope of potential impact of our work. But with that said, we have to work within their the parameters and within their interest. So sometimes you have to take your research idea, make it a smaller idea, make it a digestible research question, if you will, to have it attractive to funders. So I found over time, sometimes what you feel like initially almost constraints put on us by funders actually help us to produce more pragmatic or practical research projects. The other piece of advice, I'd say go to where your partners are. You may have to adjust your approach based on who your partners are. So I think as a researcher, if you stick too closely to your initial idea and aren't able to compromise and bring in the perspective of your partners, then a lot of times you might win the battle, so to speak, and lose the war. You might lose those critical partners. So I think being flexible, and it's very hard to do when we think we have a really great research idea, is a critical part and an important piece of advice I would give researchers. A question that you all ask is, how do we identify the strategic direction of our research? What factors influence our decision to pursue these specific applications for the healthcare research? Again, I think with the particular example of health extension for diabetes, we saw a unique opportunity. First, we had amazing health system partners. In our case, Clemson does not have a medical school, but we had some very strong partnerships with Prisma Health and MUSC, the two largest healthcare systems in South Carolina. And we had some great partners who were very, very focused on chronic disease management and the particular issue of diabetes. So we wanted to leverage those partnerships. Our second thing that I think really drove the direction of this particular program is that Clemson is a land-grant university and we have our extension network. And we thought, how again do we leverage that very important network? The extension network has been known for many decades as being very, very good at education and outreach. How do we leverage those resources to help improve something like diabetes and chronic disease? So that felt like the sweet spots to really build this particularly program of intervention and evaluation research to impact diabetes. That we had great partnerships. We had great internal partnerships in the extension network and the land-grant mission of Clemson, and the fact that for me personally, I had a history of working with healthcare systems, building healthcare programs administratively, and I knew that industry very much. So I would say, if you're thinking about strategic direction of your research, what is your passion? What do you know about? And what partners do you have that you can work well with? And so I hope that the example of health extension for diabetes is one that provides some insight and perspective for folks in STRIDE. I feel very, very fortunate that I've gotten to work on this program. I'm not sure any other job that somebody could have, that you could have something that you just keep working on for 8 years and starting and stopping and getting funding and working with teams and meeting great collaborators. I feel like I've had a lot of blessings in that space, and it's been made my job as a faculty researcher much more rewarding.